husband's in the military, and we were stationed down at Fort Rucker, Alabama, and we decided to go ahead and get pregnant again. I went to my first ultrasound at 8 weeks pregnant, and we noticed a lump in my breast.
Doctor didn't really alarm us or anything. Oh, I want to schedule an ultrasound. It's probably nothing. Her gynecologist called, told her to come in. She said, well, why don't you bring your husband with you? And that's when she knew that it wasn't good news.
And it turned out that I had stage 2 breast cancer. They sent me to a general surgeon, and that general surgeon honestly had no idea what to do with my case. He told me he wasn't sure if I'd be able to keep the baby. My doctor didn't know that I could have treatment, and because my doctor didn't know, I didn't know. And that's just unfathomable to me.
Really wanting to maintain her pregnancy. The initial response had been that was not going to be possible for her, so she sought additional medical information and support, and that's how she came to us through Family Connections in St. Louis.
We know there's many great hospitals in St. Louis. We knew of Siteman. I met with Dr. Naughton. He told me at the end of this, we're going to have a healthy mom and a healthy baby, and I couldn't ask for anything more.
Breast cancer during pregnancy is not very common. You know, pregnancy obviously is mostly young women. Most young women fortunately don't get breast cancer. The good news is we've had very successful outcomes for the pregnancies.
They didn't want me to do anything in my first trimester. So I waited until I was 12 weeks pregnant, and then I started what would be 6 rounds of chemotherapy. And they gave me the drugs that I was able to take while pregnant. Going in that day, to have her being induced, every fear goes through your mind. Is she gonna be healthy? You know, is there gonna be anything wrong with her? And, you know, she came out perfect.
I couldn't ask for anything more. The confidence that they exuded, it put me more at ease, even though I couldn't be there. As soon as I got up here and met everybody, they were everything I expected and then more.
Water?
When patients are faced with a cancer diagnosis, it's always a serious issue. So I think especially anything that's an atypical situation, getting a second opinion where you may just get verification of what you've heard previously, but at least getting the assurance you're on the right path.
Siteman is more worried about the comfort and the care of their patients. They're there for us. We're not just going to their office, their place. They are wanting to make things more comfortable for us. And I couldn't ask for anything more.
We're very proud of the Siteman Cancer Center. It's developed quite a bit over the last 15 years. We've got a whole spectrum of very skilled professionals, whether it's surgical or radiologic or oncologic or other supportive care services. So when a patient comes here, they've just got a great number of resources available to them.
If I wouldn't have gotten my second opinion, I wouldn't have my little 15-month-old that I'm chasing after. I couldn't imagine a life without her.